Okay, today we're going to be talking about dental diseases. So before I start talking about diseases, we need to talk about the four major components of our teeth. So first is the enamel, which is the mineralized outer layer that protects the inner layers from any damage. Then there's the dentin, which, as you can see on the diagram, it's the middle layer between the enamel and the pulp, and it just provides support, transmits impulses from the animal to the pulp, and gives the teeth their color. And then there's the pulp, which is the soft inner layer. It's made up of blood vessels, as you can see here, which transport oxygen and nutrients to the nerves, and it has cells called odontoblasts, which are basically a type of cell that produce dentin. And the last component is the cementum, which is right at the bottom. It's the hardest layer, which anchors the teeth in its socket, and it attaches the tooth to the alveolar bone by connecting with collagen fibers in the periodontal ligament, as you can see there. So the first disease I'm going to talk about is dental caries, which is basically a disease characterized by demineralization of the enamel and the dent underneath. So what happens is plaque, which is a sticky form of bacteria, it forms on your teeth, and that metabolizes the sugars you consume, like in carbohydrates, and that produces acids which attack the enamel, causing holes in the tooth surface, which we know as cavities. And eventually the decay progresses deeper down into the dentin layer, and that causes hypersensitivity, which we're going to be talking about on a later slide, and eventually goes into dental pulp, which results in inflammation, swelling, and a lot of pain. So there's three treatments for dental decay. First is fluoride, which is used for if it's in the early stage, such as like stage 1, as you can see here. So fluoride can be in mouthwash, varnishes, gels, etc. And it repairs the enamel through remineralization and just reverses any early tooth decay. And then the most common treatment that everyone's probably heard of for cavities is fillings, where the decayed tissue is drilled out and it's replaced with different materials, such as composite resin or amalgam, which just prevents further decay. And then the last, most extreme form of treatment is root canal therapy. That's used when the decay has progressed to the pulp. So the infected pulp is removed to just remove the bacteria, and the whole infection is cleaned off, and the pulp is refilled. And then a crown is placed over the tooth to just seal the wound and make sure and provide strength. Another type of disease is periodontal disease, which is a disease characterized by, it's a chronic inflammatory condition, and it's a chronic inflammatory condition which affects the tissues supporting the teeth. So the same thing happens, plaque, which is a sticky form of bacteria, accumulates along the gums and it becomes hard and forms tartar, which leads to inflammation of the gums, and that's known as gingivitis. Eventually the inflammation spreads to other parts of the periodontum, which is a group of tissues that anchor the teeth in their place, and that causes the alveolar bone to erode, which results in teeth becoming loose or mobile, which is why teeth fall out. Another feature of periodontal disease is the gum tissues, they pull away, forming periodontal pockets, as you can see in that picture there. And they also may begin to bleed, and pus can build around the gum line, which causes chronic bad breath, and that's called halitosis. So for periodontal disease, they can either be, other factors of periodontal disease that can cause it, there's plaque, but there's also other factors such as genetics, hormonal changes, diabetes, and smoking. So for treatments, they can either be surgical or non-surgical treatments. So non-surgical ones are antibiotics, either just oral or topical, so they're applied only to the pockets, and that just fights the bacterial infection. Or there's scaling and root planning, where the gums are numbed and then any tartar is removed by scaling, and then the root surfaces of the teeth are smoothed out to prevent any bacteria from building up. And in the surgical treatments, one of them is bone grafting, where graft is made either of the patient's own bone or some artificial material, and that's just used to stimulate regrowth of new bone, of new alveolar bone. And there's also guided tissue regeneration, which is when a special material is placed between the existing bone and the tooth to prevent any unwanted tissue from growing, so that the bone can grow back instead. And there's some more surgical treatments, which I haven't mentioned up there, such as gum regeneration, gum grafts, platelet-rich proteins, and tissue-stimulating proteins, which all do the similar thing, pretty much. And yeah, over to Sabeen.
So I'm going to be talking about oral cancer, and oral cancer is normally cancers of the mouth and the back of the throat, and it could develop on the tongue and the tissue line. So over here, this is one of the more tame pictures that I found on Google, that it's on the inner lining of the lip, so that also comes into oral cancer. and obviously your risk increases with age, and it can be caused by tobacco use, alcohol, or sun exposure. And then the symptoms may be like mouth ulcers, patches, pain, and there's just like maybe like spots kind of thing in your mouth. And to lower the risk, you should eat a healthy diet, exercise, and reduce your alcohol and tobacco intake. So there are these sites for oral cancer are the most common. So over here, the lining in your mouth, or maybe your tongue, the roof of your mouth, just those kinds of areas, anywhere like in your mouth region. And treatment is obviously it depends on the size of your tumor and how long it's been there for. So the three most common ways of treating this is surgery, chemotherapy, and radiotherapy, like it's in many other cancers. And the next thing is stem cells in treatment. So stem cells could be used to regenerate new teeth, and that just helps in making sure that you have all your teeth and they're all perfectly healthy. It can also regenerate dental tissue, and it helps in the correction of bone abnormalities. So the main sources of your stem cells are in your oral and maxillofacial regions, which is your throat or your mouth, just anywhere around this area. And there are 5 main types of stem cells. Over here are the locations of all of them. So your dental pulp stem cells are obviously inside your dental pulp, so around here. Your stem cells from exfoliate deciduous teeth. So deciduous teeth are your primary teeth, so as we know them, there are baby teeth. So over here you can see that this is an immature adult tooth, that's your baby tooth, and you can harvest these stem cells from the inner pulp over here. And then you have periodontal ligament stem cells, which are on the root surface, and they could be taken out. I'm pretty sure they're harvested by using a diamond drill to open up your tooth, and then they're harvested, and that's how you get stem cells. And then there's stem cells from apical papilla, which are SEAPs. Those are on the bottom of your root. And then you have dental follicle progenitor cells. So over here you have your wisdom teeth. So around this dotted line is where you would find those stem cells. So there's lots of different sites, and obviously it depends on the type of case you have and also how old you are. Because say if a child needs any treatment, then they would obviously be getting these kinds of cells, or if an adult needs it, they could get these kinds of cells. So it really just depends. The next thing is on tooth sensitivity. So tooth sensitivity could indicate a disease, and main causes of it is like excessive brushing, your worn enamel, exposed roots, cavities, and obviously gum disease. So your symptoms would be pain or discomfort when eating hot food, and pain when brushing, bleeding in the gums, and treatment for that would be root canals, so your the whole tooth would be removed. Fillings is the most common treatment, where you would obviously just fill your teeth, and then a fluoride treatment, which restores the enamel and reverses the decay. Now, prevention for many of these diseases are these factors. So you should drink fluoridated water and brush with fluoride toothpaste, which protects your enamel, strengthens it, so there's a tougher barrier for any disease to get through. And you need good oral hygiene, so like flossing, brushing twice a day, that would just remove your dental plaque, which could also be a cause for disease. And you should be visiting your dentist at least once a year, even if you think that there's nothing wrong, because that just means that if there is some kind of hidden disease, your dentist can catch it early, and the earlier you catch your disease, the quicker it can be treated, and the simpler it is to be treated. And yeah, so limiting alcohol and tobacco products and having a balanced diet all tie into preventing disease. So thank you for listening.